From the point of view of both robotic companies and also from the people who teach, the proctors, the entire education department, the viewpoint is that we should be directing our attention now at junior trainees, because very many documents have been written, including the future of surgery, that clearly covers the fact that robotic surgery is not only here, but it is here to last. It is going to be changing over the next 10 and 20 years, but the earlier people can get involved with that, the better. And so training has to now be focused at a different level for people who have different priorities.
I think there are a number of aspects that we need to consider when thinking about robotic training, particularly earlier on in the training pathway. Clearly, we can see from those delegates who have come today that there is no lack of enthusiasm and motivation, which is really excellent to see. I think that needs to therefore be met by more opportunities such as this for our trainees who are earlier on in their career to have access to robotic technology, to have access to proctors and trainers who have experience in robotic technology. So it really needs to be met on both sides. Personally, I think there's, when it comes to robotic training, we need to think about the robot as a way of doing an operation rather than a completely different operation. So I don't feel that you need to start with open and progress to VATS and then finally come to robotic training further on. I think that the real benefit will come from using this technology and becoming experienced in this technology early in your career pathway. And so that's why it's really important for our junior doctors to have access and opportunities in this area.
I think the future of thoracic surgery, there is a big role to play in navigation bronchoscopy with the number of small nodules we're now identifying that needs biopsy and treatment and increasing retreatment of patients. I think the navigation bronchoscopy must be part of the curriculum. The biggest barrier at the moment is that there aren't enough centers doing it, and the training opportunities are very few and far between. In the UK, interventional pulmonology is also a relatively small specialty, so there will be a big need for doctors who are able to do that in the future. And there's nothing better than starting young early in the training program to get junior doctors exposed and becoming expert at this. After all, it is a video related technique, and we know that the next generation are particularly good with the hand-eye coordination with video techniques.